Hematuria, a clue to hidden diseases' clinical pattern recognition. Blood in the urine, or hematuria, is a symptom that can tell us powerful stories about what's happening inside the body. Sometimes it's harmless, but other times it's a signal, a message pointing to deeper problems involving the kidneys, the immune system, or even the lungs. In this video, we'll explore 5 important clinical patterns of hematuria, how to recognize them, what they mean, and what conditions they point to. Pattern 1. Hematuria plus proteinuria plus hypertension plus periorbital edema glomerulonephritis, or GN. When hematuria appears with protein in the urine, high blood pressure, and swelling around the eyes, think of glomerulonephritis, often abbreviated as GN. This is inflammation of the glomeruli, the kidney's filtering units. The inflamed filters start leaking both red blood cells and proteins. The protein loss causes fluid retention, especially visible as puffiness around the eyes in the morning. And as kidney function declines, blood pressure rises. In short, hematuria plus proteinuria plus hypertension plus periorbital edema equals glomerulonephritis. A classic triad every clinician should recognize. Pattern 2. Hematuria plus hemoptysis plus crescent formation in kidney plus rapid renal deterioration Goodpasture syndrome. Now, if hematuria is joined by coughing up blood and kidney biopsy shows crescent-shaped glomeruli, this points to Goodpasture syndrome. This is a rare but deadly autoimmune disorder where the body's antibodies attack both the lungs and kidneys. It causes pulmonary bleeding and rapidly progressive glomerulonephritis. Clinically, a patient with hematuria and hemoptysis should raise immediate red flags. This is a medical emergency because kidney failure can occur in days or weeks. Pattern 3. Hematuria plus cramping abdominal pain plus P/R bleeding plus painful palpable purpura plus arthralgia is due to Henoch-Schonlii purpura, HSP. When hematuria is seen in a young patient with abdominal pain, bloody stools, painful purpura, and joint pain, we think of Henoch-Schonlii purpura, now called IgA vasculitis. It's a small vessel vasculitis often following a respiratory infection. The immune system deposits IgA complexes in vessels of the skin, kidneys, and intestines. The result? A child with purple rashes on the legs, tummy pain, blood in urine or stool, and joint swelling. Usually self-limited, but sometimes it can damage the kidneys, so always monitor renal function carefully. Pattern 4. Hematuria plus epistaxis plus nasal crusting plus saddle nose plus recurrent sinusitis is due to Wegener's granulomatosis with polyangiitis, GPA. When blood in the urine is accompanied by nosebleeds, sinus infections, and even deformity of the nasal bridge, we should suspect Wegener's granulomatosis, also known as granulomatosis with polyangiitis, GPA. This is another type of autoimmune vasculitis where CNCA antibodies attack small and medium-sized vessels, especially in the respiratory tract and kidneys. A classic picture. Recurrent sinusitis, nasal crusting, a collapsing nasal bridge called saddle nose, and hematuria. Without treatment, it can progress to kidney failure or lung hemorrhage, but with modern immunosuppressive therapy, outcomes have greatly improved. Pattern 5. Hematuria plus resistant asthma plus eosinophilia, greater than 1,000, plus neuropathy is due to Churg-Strauss syndrome, eosinophilic granulomatosis with polyangiitis, EGPA. Lastly, if the patient has severe asthma, high eosinophil counts, nerve pain, and hematuria, consider Churg-Strauss syndrome or eosinophilic granulomatosis with polyangiitis, EGPA. Here, the body's immune system causes inflammation in blood vessels, especially affecting the lungs, kidneys, and nerves. Key clues. Persistent asthma that's difficult to control. Eosinophil count above 1,000. Numbness or weakness due to nerve involvement. And kidney inflammation causing hematuria. Recognizing this pattern early can save organs and lives because each PA responds well to corticosteroids and immunotherapy if diagnosed in time. So next time you encounter hematuria, don't stop at the urine. Ask what else is happening in the body. Is there swelling? Coughing blood? Rash? Sinus issues? Asthma? Each combination tells a different story, from glomerulonephritis to good pastures, from HSV to GPA or eGPA. Medicine is all about patterns, and hematuria is one of the most powerful clues we have. If you found this video helpful, don't forget to like, subscribe, and share it with your fellow learners. Thank you for watching.